Antibiotic resistance is the ability of bacteria to survive in the presence of antibiotics. Drugs are designed to target and disrupt specific parts of their life cycle.
Bacteria can adapt multiple mechanisms to avoid being killed by the antibiotic, which means the treatment becomes ineffective against particular infections.
Bacteria are evolving to become more resistant to these antibiotics and resulted in superbugs such as MRSA that now threaten the lives of thousands of the most vulnerable people around the globe today.
Genes that confer antibiotic resistance have naturally occurred in bacteria for millennia. However, inappropriate use of antibiotics is causing an unprecedented rate of increase in the occurrence and strength of the phenomenon. A recent project led by Prof Eason at the University of Southampton is currently developing a testing kit with the aim of correctly identifying bacterial infections so that antibiotics can be correctly prescribed.
One of the problems why we have antimicrobial resistance is the excessive use of antibiotics. So if you can stop that use of antibiotics, then that would be a great help. So if you have a point of care test which helps the doctor identify whether he wants to use an antibiotic, whether he needs to use an antibiotic, and if he needs to use an antibiotic, what sort of antibiotic he needs to use, and what dosage levels, then that would be a great help. So the test is very similar to a pregnancy test where you have a single flow path which helps you identify a certain hormone in the urine. In this case, what you have is instead of a single flow path, you have 4 different flow paths or 5 different flow paths or whatever, X number of flow paths, which help you identify 5 or 6 or 7 different types of bacteria. So on one side of the test, you have a set of flow paths which help you identify what the bacteria is. On the other side, you have a set of wells which helps you identify which antibiotic it is susceptible to.
Rather than having to wait to queue up for a doctor's or try and get an appointment when they're busy, when they say we can't see you for 10 days, and you want a diagnosis now. So this lets us do it for the people at the point of care where they want to have their tests rapidly diagnosed, and it's a very cheap and appropriate method of doing it, we think.
The testing kit will also have other applications, such as being readily available in developing countries, ensuring the correct prescription of antibiotics for infections in poor or hard to access communities. It could also be used on site to test for bacteria in domesticated animals and indicate the antibiotics needed. And it can be applied to the issue of water purity. You could use it to test for harmful bacteria in drinking water.
The testing kit is revolutionary. It has the potential to make accurate diagnosis of bacterial infections and rapid testing for antibiotic resistance.
It is accessible to every patient right at the point of care, whether that be at the GP office, the hospital, or even at home.
It has the capacity to equip everyone, both patient and doctor alike, with the toolkit required to combat the evolution of antibiotic resistance. With the growing pandemic of antibiotic-resistant bacteria, it is vital that immediate steps are taken by the international community to reduce the irresponsible use of antibiotics that have caused this plight.